following presentation is a project of the Native American Women's Health Education Resource Center. Some general statistics. 4 out of every 5 Americans begin having sex before the age of 20. 70% of those in this group that are younger than 13 report having had sex forced upon them. By the time they turn 20, about 40% of American women have been pregnant at least once. 57% of American Indian women reported having had sexual intercourse by the 12th grade. 14 was the average reported age of first intercourse. 42% of all American Indian mothers reported being under the age of 20 when they had their first child. 92% of American Indian girls who have had sexual intercourse reported having been forced against their will to have sex. 62% of those girls reported to have become pregnant by the end of the 12th grade. 27% of American Indian youth reported having received no routine health care in the last 2 years. 41% of American Indian youth reported having no health insurance at all. There is a staggering amount of violence directed against Native American women. The incidence of rape in the American Indian community is 3.5 times higher than among other communities. That means over 1 in every 3 Native American women will be raped in her lifetime. In a recent survey, 44% of Indian Health Service emergency rooms reported not having an accessible protocol or trained personnel in place for sexual assault. For facilities that do not provide services to sexual assault victims, women are required to travel an average distance of 28 miles and some as far as 150 miles to obtain services. U.S. teenagers have higher rates of pregnancy, birth, and abortion than adolescents in other developed countries. U.S. teenagers are much more likely to become pregnant unintentionally than teenagers in other developed countries. They are also more likely to want to become mothers. South Dakota surveyed about 1,800 high school students between grades 9 and 12 in 2003. The survey aimed to find out the statistics on the risky behaviors that youth in South Dakota were taking part in. The survey found that the average percentage of South Dakota youth who have had sexual intercourse in high school was 42%. It found that the average percentage of South Dakota youth whose doctor or nurse discussed ways to prevent pregnancies and/or STDs with them was only 20%. South Dakota has an abstinence-only education program requirement. Its goal is to reduce teen pregnancies and to reduce the physical and psychological health risks that accompany early sexual activity without teaching necessary information regarding contraceptives. Denying correct sexual health information is not helping young people. Instead, it is hurting them. Every year, 3 million sexually active teens, about 1 in 4, get an STD. Out of every 20,000 new HIV infections in the U.S. each year, half of those infected are between the ages of 13 and 24. Every hour of every day, 2 young Americans are infected with HIV. South Dakota's abstinence-only education program attempts to reduce teen pregnancies without giving correct information. This explains why it is not working, and instead it has resulted in the following. Between the ages of 10 to 24, there were 304 cases of gonorrhea and 2,534 cases of chlamydia in 2004. This is a list of youth advocacy education websites. For more information, contact the Native American Women's Health Education Resource Center, Pidamaya.